Namaskar. Welcome to Pranashakti Foundation's Sunday webinar. Today, we have Miss Bhakti Katagiri with us. She is a M.Pharm graduate specializing in pharmaceutical chemistry. Madam Bhakti, now I would welcome you once again to take this session forward.
Thank you, ma'am. Namaste and hello everyone. I am Bhakti. I am a pharma chemist and I welcome you all to this session where we'll be discussing in brief about anti-diabetic medication and their side effects. So let us start with the session. So diabetes is a chronic metabolic disorder which is characterized by elevation in blood glucose level, or we can say blood sugar level. And this condition occurs when body's ability to produce insulin or to regulate the blood sugar is impaired. And there are three main types of diabetes, that is type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the insulin cells produced by the pancreatic cells, or we can say beta cells. And as a result, individuals suffering from type 1 diabetes require lifelong insulin therapy to manage their blood sugar levels. And it is typically seen in childhood or in teenagers, and it cannot be prevented. While type 2 diabetes, most common form that we can see, and it develops in adulthood, but also it can occur in childhood or teenagers these days. In type 2 diabetes, what happens is the body becomes resistant to the insulin or its activity. The insulin is produced, the pancreatic cells produce insulin, but it is not enough. And even if it is enough, sometimes the sensitivity towards the insulin gets reduced. And there are many factors that are involved, like genetics, obesity, lazy lifestyle, and poor diet. But type 2 diabetes can be managed with lifestyle, medication, and diet, exercise. And common symptoms of diabetes include frequent thirst, frequent urination, unexplained weight loss, fatigue, or vision becomes very blurred, and the wound healing process gets slower and slower by time. And some individuals may have diabetes even without experiencing these noticeable symptoms. That's why regular checkups is very important. And poorly managed diabetes can lead to various complications, including heart disease, stroke, kidney, liver damage, and eye problems, nerve damage, and limb amputations in severe cases. So proper management and blood sugar control is very essential to prevent these complications. So anti-diabetic drugs play a very important role in management of diabetes mellitus. The primary goal of anti-diabetic medications is to help to regulate the blood sugar level, and these drugs help by improving the insulin sensitivity. They also increase the insulin production, and they decrease the production of sugar levels. This is how they work. So the effective use of anti-diabetic drugs along with healthy lifestyle, proper diet, can lead to a better long-term health for patients suffering from diabetes. Now let's talk about the medications used to manage diabetes and potential side effects with them. There are various types of anti-diabetic drugs available in the market, and each of them have their own mechanism of action. They have different side effects, which allows the healthcare professionals to plan the treatment to the specific needs of each patient. So personalized treatment increases the chances of successful blood sugar control while minimizing the side effects. So types of diabetes medications: metformin, glipizide, pioglitazone, rosiglitazone are the most common anti-diabetic oral medications that we see in our day-to-day life, but they have different mechanism of action and they act differently inside body. So metformin is typically prescribed to the patient suffering from type 2 diabetes to help lower the blood sugar and stabilize the blood sugar levels, and it acts by reducing the glucose production in liver, and it controls the blood sugar level, and it also increases the insulin sensitivity of muscle cells, which helps the body to use the glucose more effectively and provide energy to the body. It is also sometimes used in combination with other diabetic medications. It is also used in combination with insulin, and there are some benefits of using metformin. It can also help lower the risk of cardiovascular diseases in people suffering from diabetes. It also helps with weight loss in some individuals, and there are some side effects seen while using metformin. Common side effects include gastrointestinal symptoms, nausea, diarrhea, and stomach upset. These side effects can be often minimized by starting with a low dose treatment or dosage regimen, and then gradually increasing it with time. In rare cases, metformin can also cause serious side effects like lactic acidosis, but if it is used carefully, it is one of the good medicines that is used regularly. And there are some things that need to be considered when administrating anti-diabetic medicines. Metformin should not be used in people those who already have kidney damage or kidney dysfunctioning or certain other medical conditions. So it is very important for the healthcare provider or the practitioner to access the patient's medical history and then prescribe the medicines. Another common anti-diabetic tablet or oral tablet is glipizide. So glipizide works by stimulating the release of insulin from the pancreas. This insulin then helps the body cells or muscle cells to accept or helps in intake of the glucose from the bloodstream, which then lowers the blood sugar level in blood. It is often used when the diet and the lifestyle changes are insufficient, or it is also used in combination with other diabetic medicines like metformin. And the dosage of glipizide depends upon the individual's need or the response of the individual's body or the system to the medication, and it is usually taken before the meal because it stimulates insulin release and it responds well when the food is taken, and this helps to control the post blood sugar spikes. And common side effects of glipizide include hypoglycemia, where the blood sugar level decreases, which is not a normal case. So it is called as hypoglycemia. Weight gain can be seen. Patient may suffer from nausea and vomiting, also gastrointestinal discomfort. And glipizide should not be used in people having severe liver damage. We will now discuss another anti-diabetic medicine, that is pioglitazone. Pioglitazone works by improving the body's sensitivity to insulin, and it also has side effects including weight gain, swelling, fluid retention in limbs, and an increased risk of heart failure. It may also lead to increased risk of bone fractures, especially in women. And additionally, it can cause liver enzymes to dysfunction. That's why regular monitoring of liver functioning is necessary when these medicines are prescribed. And alongside medication, people with diabetes are often encouraged to make lifestyle changes such as adopting healthy diet, getting regular exercise, managing stress, and monitoring their blood sugar levels to effectively manage their condition. It becomes necessary for people with diabetes to keep their mental health fit. Diabetes being a chronic medical condition not only affects the physical health but also mental health, and the daily routines of monitoring blood sugar levels, taking medicines, meeting the doctors, and making dietary and lifestyle changes can be really tough for patients. So stress can lead to elevate blood sugar levels, making it more worse and challenging to control diabetes. And also research has shown a strong connection between diabetes and mental health conditions like depression and anxiety. People with diabetes are at higher risk, and mental health conditions like depression and um, anxiety can worse their condition. Not only diabetes contribute to mental health problems, but mental health or the mental issues can also worsen the diabetes management. Depression can lead to poor self-care, including neglecting the medication, and mental health issues, especially when they lead to poor diabetes management, can increase the risk of diabetes-related complications such as uh, eye damage, heart disease, or gastrointestinal problems, kidney damage, and also uh, neuropathy. Good mental health is also essential for adherence to diabetic treatment plans. When individuals are mentally well, they are more likely to follow the doctor's recommendations. They follow the proper diet, they follow the exercise and other uh, instructions given to them, and they also take up regular checkups. So it is important for patients to prioritize their mental health and seek support whenever they need. This may involve working with mental health professionals, joining support groups, practicing stress reduction techniques like mindfulness or meditation, and integrated care, both physical and mental health aspects, is very important and effective approach to manage diabetes successfully. Now, coming back to the anti-diabetic agents, in addition to oral remedies, there are also insulin therapies that is a very important component. And anti-diabetic drugs include different types of insulin with varying onset and varying duration. For some people, single antibiotic drug may not be sufficient to achieve optimal blood sugar control. So the combination therapy, which involves using multiple medications, multiple medicines with complementary action of insulin injections, can be effective. This allows better control while minimizing the side effects. And when a physician or a doctor prescribes medication, a patient's medical history is studied thoroughly to know if the patient is already on some medication. If the patient uh, suffers from organ damage or any other complication, uh, then it is important to avoid the drug interactions. Drug interactions occur when one medication affects another medication or any another substance present in the body. These interactions can lead to various side effects and reduce therapeutic benefits. And drug interaction or drug alcohol interaction, drug and herbal interaction can cause few types of unwanted side effects. Now, managing drug interaction is important for people with diabetes because they often take multiple medications to control their blood sugar levels. People with diabetes often take oral medication that can interact with other drugs, affecting the blood sugar levels. For example, glipizide can cause increase in or hypoglycemia, especially when it is combined with alcohol. And pioglitazone may cause fluid retention or swelling in limbs. So medications that affect the kidney function can again impact on the functioning of metformin. Kidney function should be monitored regularly when taking metformin along with the other drugs that affect kidney. And here, as we can see, there are different types of interactions shown. So many people with diabetes also have blood pressure and take medications to control it. Some blood pressure medications can also affect the blood sugar level. It usually increases the blood sugar level. So the healthcare provider should adjust the dosage, and closely monitor the response from the patient. Various other medication can interact with diabetes medication, like antidepressant, anti-seizure medicines, and certain antibiotics. Alcohol can interact with many diabetic medications. There are chances of drug herb interactions as well that can take place when diabetic individual consumes herbal supplements along with the prescribed medication and other over-the-counter products or OTC products. Cinnamon is one such popular herbal remedy believed to have a blood sugar lowering property, but when it is taken along with the allopathic medication, the combination can lead to a severe case of hypoglycemia. Another example is bitter lemon, another remedy for diabetes. It has a very potent quality like cinnamon. It also increases the risk of hypoglycemia. Aloe vera supplements or aloe vera juice uh, is used to manage the blood sugar level, but it can interact with the diabetes medication and can cause severe other dysfunctioning like kidney damage or liver damage. It can also interfere with the functioning of different enzymes. So to minimize the risk of drug interaction, it is necessary to inform the healthcare provider about all the medications, supplements, and the herbal products that the patient is using, including the prescription and over-the-counter products. And some common habits that can be adopted to prevent such interactions is reading the medication labels, patient information sheets, the warnings closely, and immediately informing the doctor if any unwanted reaction or adverse reaction is seen. And as we previously talked about alternative medicines and herbal supplements, these really help to prevent or manage various disorders. However, it is necessary to consult a doctor before consuming any such kind of medicine. Nowadays, people are shifting their preferences to Ayurvedic system of healthcare. As we all are aware that uh, Ayurvedic healthcare is an ancient medicinal practice that is emerging as complementary and as the alternative treatment for chronic illnesses. It offers a holistic approach to the health and wellness, including management of diabetes. And Ayurvedic treatment is known to treat not just the symptoms, but the root cause of the disease. And the medicine is formulated according to the physical nature, body type, or according to the patient. So we can say that Ayurvedic healthcare system offers a customized regimen with little or no side effects. But it is also important to note that these traditional medicines take a longer period of time than usual to show expected results as compared to the modern medicine. People may not be tolerant to these herbal and traditional medicines because these are mixtures of different herbs and different molecules. And if we talk about allopathic drugs or synthetic drugs, synthetic medicines are typically more potent, and these have well-defined mechanism and are made for a particular reason. So which makes synthetic medicines or the allopathic medicines the primary choice for diabetic treatment. Natural antibiotic agents are usually safe, are also used as complementary therapies, may have milder side effects. So being a pharmacist, I think that both traditional and modern medicine play a very crucial role in healthcare system, both systems having common goal of betterment of people's health physically and mentally. It can be used in combination with experts' advice to treat both acute and chronic illness. These days, people include both traditional and modern medicine, and research on this interdisciplinary healthcare system is fast increasing globally. I end this session on this note, and I thank you for your attention today. Diabetes is a challenging condition, but with proper management and awareness, we can improve the quality of life for those affected by it. And I'm happy to answer any questions you may have. Thank you.
Thank you, Bhakti ma'am. It was a very eye-opening presentation. Yes, we have some questions coming up from our participants. So I would like your permission to get started.
Yes, ma'am, sure.
Yeah. The first question that we have is that you highlighted that type 1 diabetes is generally something which emerges in the childhood. Is there any probability
Yes.
it can come in later phase of life, in the adulthood?
Yes, ma'am. Yes, it is possible. But because type 1 diabetes uh, occurs due to the improper functioning or lesser sensitivity or destruction of the pancreatic cells, this is usually seen in the childhood because the immune system is playing against its own cells, or it's attacking its own body. So usually when a kid, when there is a child suffering from autoimmune diseases, we can see he can manifest type 1 type of diabetes. So
Now
most of the time it is seen in type 1.
Yeah. In Western countries, especially, we are seeing, because many of our members are from the Western country, we see that there is a predominance or growth in the cases of autoimmune disorders like lupus and other disorder. Those disorders, can they affect the pancreatic cells that produce insulin in the later phase of life also?
Yes, ma'am, it is possible. As I told already, autoimmune disorder means the immune system is working against the owner's body or against our body. So it interferes in so many functions that are taking place in the body. So it destroys immune cells, it destroys white blood cells, which makes the person very vulnerable to diseases and disorders. And if it destroys the pancreatic cells, or if it reduces the sensitivity of muscle cells to insulin, it is possible that the person may acquire type 1 diabetes.
Ma'am, the second question we have is, it's a very interesting question. Is there any tests or pathological test to confirm that the pancreas is releasing insulin, or it is not releasing adequate insulin, or the cells are totally damaged? Are there tests for that?
Yes, ma'am, tests can be done. There are so many kits available. We call them in vitro testing kits. So there are different companies who make these kits, and you can test it at home or at any laboratory. That can be done. Again, biopsy can be done. There are so many tests. So usually what clinical people do is they test the insulin functioning or the presence of insulin using these marketed kits.
And the amount of the insulin, if it is decreasing, can it also be evaluated with the help of tests, or it is just like averaging? They do average calculations they are doing.
No, to increase the insulin level, the patient needs to take the medicines or should undergo therapy. The tests only explain, or they only indicate the level of insulin in the body or in the blood.
Okay. Okay. And with the presence and with the difference between the amount of blood glucose still left over in the blood, they identify that the insulin is not adequate, or the amount of glucose intake is more. Means, I mean, the carbohydrate intake is more. Is it like that the clinicians infer?
Yes. Most of the times, 2 times the blood or 2 types of blood sugar tests are done. That is before meal, means after complete fasting,
Okay.
and random. So fasting TP and random blood sugar level. These are 2 types. So random blood sugar is there is no need of doing the fasting. You can have your meal like every day, and then the blood is tested. So they'll be knowing what is the condition of the blood sugar level when the person is having his 3-time meal or regular meals. And again, fasting TP is another type of test which is done where you have to keep fasting for 12 hours. Exactly after 12 hours, once you have your dinner at night, after 12 hours, your blood is withdrawn and then the sugar level is checked. So comparing these two types of tests, the person or the doctor or the clinician can tell exactly what's going on.
Understood. Okay. Ma'am, what is the correlation? Is there any correlation in the first place between fatty liver and diabetes complication?
Yes, ma'am. Fatty liver, it fatty liver means it is again caused. It again causes the enzymes present in liver to dysfunction. So liver is the main, or we can say one of the main organs which is responsible for digesting almost everything that we eat or that we take. Uh, it can be food or the medicine or anything that we consume that first goes to the liver. So liver is one site, very important site where the metabolism or the breakdown takes place, and liver has the major enzymes working uh, working for breakdown or for metabolism. So if fatty liver is again a disorder, or we can say disease, which is not a normal condition, in that case obviously the enzymes are not working properly. If the enzymes are not working properly, the metabolism or the breakdown of the sugar is not happening properly, or the blood glucose is or the glucose level in liver may be produced more. So again, it can elevate the blood glucose level. That's why it is the doctors suggest that liver and kidney functioning should be monitored regularly, because these two organs are very important and play a very significant role in uh, everyday uh, everyday functioning of our body. So if these are not working properly, or these are damaged, or part of these organs are damaged, there are chances that the person can acquire other chronic illnesses like diabetes, like hypertension, or in some cases also cancer.
Understood. Okay. Okay. Yes, ma'am. Ma'am, nowadays people are using, due to the popularity of Ayurveda, people are going to the shops and they are picking up OTC Ayurvedic prescription for anti-diabetes, or they are using home remedies. How dangerous is it when they are already on allopathic drugs?
Yes, as we already discussed in this session, that synthetic or allopathic drugs are primarily uh, built, or they are synthesized for one major role, that is if it is an anti-diabetic drug, it is manufactured with a primary goal to act as an anti-diabetic drug. It is that specific. But if we consider OTC products or home remedies such as herbal drugs or different types of herbs that we use in our day-to-day life, these are mixture of different types of molecules or different natural molecules present in them. Aloe vera is used as anti-diabetic. Aloe vera is again used as laxative, and it is also used as spasmodic. It has so many different functions, while it is not the case with allopathic drugs. So allopathic drugs are and anti-diabetic allopathic drug is working as anti-diabetic only. There are exceptions, but it is designed to work as anti-diabetic, while herbs are not so. Herbs are very complicated, and they are abundantly having the molecules present in them. So there are so many molecules that one herb can give rise to thousands of different medicines. So in that case, so many molecules are already present in a herb or in the OTC, and when it is combined with the allopathic drug, it can reduce the blood sugar to to a level where person can experience severe hypoglycemia.
Yes.
So again, that is more dangerous than hyperglycemia. Hyperglycemia can be controlled easily, while hypoglycemia is much more dangerous than that. That's why it is considered to avoid consuming combination without doctor's suggestion.
Prolonging this discussion little ahead, as we know, we are still yet to see the integration of allopathic medicine along with Ayurveda. Means that platform is slowly gaining momentum, but still it is not in that platform what we are expecting. So there is always a clash of opinion between the allopaths and the Ayurvedists. So a common layman, what is your suggestion as a pharmacist who is primarily focused on the drug delivery and its effectiveness? How to, if somebody is very eager to take Ayurvedic medications for control of sugar, I mean diabetes, how should they proceed? Because the herb is a combination of so many molecules doing so many things in the body. How to have a safety profile in the place? Can you guide us on that?
Yes. Now, be it allopathic medicine or Ayurvedic medicine, it is always necessary to find a doctor or find a Vaidya who is practicing. So they have great knowledge. They study things thoroughly, and even if we use herbal products or Ayurvedic products day-to-day life, we are not aware of what type of body we have or what is the main prakriti. These all things are considered in Ayurveda, which makes it more specific. That's why it has been used for so many years. These things have to be studied before taking any decision. So first advice is find a doctor or find a Vaidya, and then start a dosage form with less amount, low dosage regimen, and then see and monitor if there is any adverse effect, because not all herbal drugs are suitable to all the people. We have seen people having side effects or adverse reactions after using herbal medications. Some people are intolerant to synthetic medications or chemical based medicines, while some people are having resistance with herbal medicines. That is why it is important to start with a low dosage form. If the person is able to handle the small amount of dosage form, then gradually it can be increased, and of course with regular monitoring and regular checkups, and then carry on with the medication.
Understood. In your practice and in your research, what is your opinion that when people come to you and ask that can diabetes type 2 be completely reversed? Nowadays, many clinics are coming up, integrated good clinics are coming up like Madhabag and all. They are working fantastically in reversing the type 2 diabetes. What's your opinion about it?
We have also studied that type 2 diabetes can be reversed. It is
Okay.
not easy, definitely, but it can be reversed. There are results. Those are reported in articles and research articles and review articles and all. So what is reversing of diabetes or type 2 diabetes is when the person or the blood sugar level in the person or in the patient is not elevating to the particular range, even after even without taking the medication for 3 months.
Oh,
If
okay.
the blood sugar level is remaining stable even without taking any anti-diabetic medication, it means there are chances or there is reverse of this chronic disease. So
Okay.
reversing of type 2 diabetes is possible, whereas it is very difficult, or I would say not possible in case of type 1 diabetes.
Because of complete destruction of the pancreas cells, as you discussed.
Yes. If we want to completely cure or try to cure completely type 1 diabetes, one thing we can do is organ transplant. It is transplantation of pancreas, or gene therapy of cells, pancreatic cells, beta cells of islets of Langerhans. These are the cells present in pancreas which are responsible to regulate the blood sugar level. So we have to do the gene therapy and change the DNA present in these cells so that they work properly, or entirely the pancreas or the part of pancreas has to be transplanted. So these are the options when we consider reversing of type 1 diabetes.
But that's a very expensive, I guess. It's a very expensive program.
Yes, it is expensive. More than that, it can be risky, because organ transplant, when we talk about organ transplant, we are transplanting someone else's organ in our body. So there are chances of, again, autoimmune diseases. The cells of our body can attack that foreign organ. To avoid that, again, people have to take immunosuppressants. And when immunosuppressants are taken, the immune system shuts down or slows down. So again, we become vulnerable to other diseases. We can easily manifest other diseases. So things go on getting complicated.
So the last question for today's session is that I have seen that I have somebody in my family who has diabetes type 2 for last 8 years. And as time is progressing, the clinician is increasing the number of the medications for controlling the diabetes. And they are stating that the diabetes is not getting controlled. So do you think that it's a good way to manage the diabetes by increasing the number of drugs? Are they not going to have any ill effects in the future time for the person?
Yes, ma'am. And as we all know that when particular amount or particular concentration of drug is given to the patient, after some time the patient becomes immune to it or becomes resistant to it. Just like antibiotics, we use type 1 of antibiotic for a particular uh, illness or for infection, but after some time, or after few years or after few months, we cannot use the same concentration or same antibiotic, because the germs or the microorganisms or the bacteria becomes immune to it. It is the same case with our cells. The cells become tolerant, and there is no good effect seen. So there is need to increase the concentration after some time. But this can lead to different adverse reactions, like after 20 or 30 years, we can see the vitamin B12 or other minerals or vitamins in deficiency starts, which is again not a good scene. There is need for the patient to take other supplements such as vitamin tablets or iron tablets. And even after that there is still no improvement, it becomes necessary for the patient to start with insulin injections. So these things keep on going. So there are so many trials going on where we can find different alternatives to such medicines, or we can find an alternative way that we can control the diabetes without increasing the regimen, or without using the combination of so many medications. The research is still going on, but for now there is no other way, we can say, because as time goes, the cells become immune to it. So either the patient needs to be given combination of 2 or 3 drugs, or one drug with increased concentration, or drug plus insulin.
Continuing with this, though we plan to conclude here, we have another question related to this. As you know, the cost of the drugs manufactured by big companies, they are becoming very expensive, especially when it comes to diabetes. Pfizer, Sun Pharma, and many mankind, and they are very good manufacturers. they are becoming expensive, and as you know, economy is not booming. So what happens is that most of the people who are in the diabetic profile, they are mostly 60, means beyond the age of 60, retired people. So it is not affordable for them to buy those expensive drugs. So now the government is coming up with the Janaushadhi outlets. So what is your take on the generic medications? Are they safe? Are they effective? um, in terms of their what they are supposed to do in the body, means and diabetes control, are they going to cause further harm, or what is your take on that as a pharmacist?
Yes, as we'll start with basic difference between generic and branded medicines. So, generic medicines are not sold under any company or any brand name. They are just sold on the basis of medicine name. So, if paracetamol is being sold, they will name it as paracetamol itself. While when it is sold by a brand or by a company, by a renowned company, they name it differently. They may name it Pasimol, or they may name it as Crocin or any other thing. So the difference between the price, uh, it is because the brand need to market the drugs. They need advertising. There are so many processes involved. The packaging is high quality, or they want a different type of packaging for their company. They want to make it more attractive. The packaging system, the labeling system, these costs are included, plus marketing costs are included. Advertising or social media, or especially television costs are included. The marketing people are supposed to be paid, the medical representative or MRs. So they are getting paid to sell those medicines. So in generic, these all costs are reduced. Generic medicines are not advertised. The packaging or the labeling is kept minimal, and whatever necessary, it's kept that much. There is no need for any medical representative to go and explain about its importance to the doctor to buy it from the same company or from the same brand, because there is no brand. So this is the basic difference between generic and branded. And when it comes about quality, yes, because the brands or the companies have such reputation, they make sure that the tablets or the medication that they are selling are of top quality, because they want to stay in market, or uh, they because they market it in such a way. They claim that their products are so and so important and so functioning. So it is important, or it becomes compulsory for them to keep the quality top notch. While the generics are made for general people, there is not much funding, we can say. There is no any brand name. uh, that's where the difference comes, because they say that generic and the branded drugs are the same. We can opt any one of them, they'll function same. But I don't think that is completely true, because we have seen difference. So many students or so many postgraduates or graduates, they research on these things. They carry a long project on these things. They compare 10 generic and 10 branded tablets, and then give the results, and then it is published. So according to those published articles or the review articles, it is seen that the branded drugs always function better than the generics.
Oh, so as a pharmacist, with a sound research on this, you were telling that it is always the branded drugs will perform much better. Is it the quality of the
Yeah,
molecules? It
most
is
of
the
the times.
okay. Is it the quality of the molecules better, or the infrastructure in which they are made? Everything is different when it comes to generic drug production and branded drug production. That makes a difference.
Yes, quality is one aspect, because it may happen that one of the researcher one day finds that generic drug is acting more precisely than branded product. It may happen. It is not always that the functioning of the drugs is very different or the branded is always winning. It's not that case, but most of the times it is found. So reason can be anything: the quality, the brand, or and the purity of the molecule. Because in pharma industry, more pure the molecule is, more costlier it is.
May I ask a little about it? What do you mean by the purity of the molecules? What does that mean?
Yes, I will tell you an example of gold jewelry or gold. So it is tested, or it is considered in carats. So 24 carats is uh, more pure than 22 carats. So remain, if 22 carat gold is there, so what is the other percentage? It can be any other metal, it can be silver. If there is more gold, it is more pure and more costly. Similar, there are so many impurities, we can say, not harmful, but impurities, foreign bodies, excipients. And because I'm a pharmaceutical chemist, we learn more about chemistry. I will give you one example of glucose particle. If we there are two types of glucose: glucose D and glucose L. Okay, so glucose dextrose, that is D, which has a slightly different chemical structure. Okay, now I'm talking about chemistry. Slightly different chemical structure. We cannot see it with our naked eyes, obviously, but there are different tests which indicate which type of molecule it is. There is glucose D and glucose L. D is dextrose, L is levo. Dextrose means right, levo is left. So these are two types of glucose molecule. Both are glucose, but different. Similar to cetirizine and levocetirizine. We have heard about it. Cetirizine is not much expensive, but levocetirizine is expensive. Okay, but one strip of cetirizine is maybe 10 rupees. Levocetirizine is costlier. One tablet of cetirizine is 2 rupees or 5 rupees something, and one tablet of levocetirizine is 12 rupees. So this is the difference. If I say pure molecule of glucose, I'm talking either about glucose D or glucose L, or cetirizine and cetirizine L. But if we want to make it much cheaper, then we can see that there is combination of these. If I want to make a generic tablet for glucose, just glucose molecule, simple glucose tablet, I want to make a generic, or I want to make a less expensive tablet. So I won't invest much time, money, and other things for separating this glucose from glucose L and glucose D. I will keep it mixed because they're working in a similar way, quite similar way. But if I want it more effective, if I want to improve its quality, I know that glucose D is working much better than glucose L. So I will try to separate this glucose L and glucose D and just make a tablet out of that glucose D and leave that glucose L. So here I'm investing my time, I'm investing so much money to purify, to further purify. So here the process increases, purity also increases, hence it costs more. Same happens with cetirizine. If only cetirizine is there, it is less expensive. But if you make the tablet out of pure levocetirizine, it is costlier. Because purifying the drug, again, costs a lot. That's why in pharma industry, it is considered that more pure a drug or a molecule is, percentage wise, it is costlier.
This is so fascinating.
Yeah.
Yeah, thank you so much for today's session. It is just the beginning of our association because our community has much to understand in terms of pharmaceutical chemistry, which is simplified by you, because there is so much to explore.
Yeah.
We hope to meet again, and again with new learnings, new research, and your take on the subject. Thank you so much for your precious time today, Pranav.
Thank you. Thank you so much.
Thank you. Thank you all. So we are wrapping up the session today. If you have any question, please feel free to post it in the group. Madam Bhakti is in the group. So she will be, whenever she is free, she will be answering your queries related to drugs and the medicines and their side effects you are taking. Allopathic drugs. Stay safe, stay happy. Meet all of you next Sunday. Namaskar.